So imagine if a smoker carries his baby, then the baby will inhale the chemicals or it may just be absorbed by their skin. So that is why it's really important for non smokers, especially children and pregnant, to avoid exposure.
You're listening to Teen Talks, Breaking Free from Tobacco and Nicotine Grip, a podcast brought to you by the Asia Pacific Learning Collaborative Network on tobacco and nicotine control. In this episode, Real Talk, the real deal on secondhand and thirdhand smoke or aerosols.
Hello there, nickel-free teens. Hi, I'm Michael, your nickel-free friend from Vietnam.
And I'm Coco, your nickel-free friend from the Philippines, and we welcome you to another episode of Teen Talks.
Breaking free from tobacco and nicotine grip.
Hi, Mai. It's so great to meet you for this podcast.
Same here, Coco. I'm happy to meet another nickel-free friend from overseas. And I am also excited doing this podcast brought to us by the Asia Pacific Learning Collaborative Network. And through this podcast, we are able to spread the word on how to break free from nicotine and tobacco grip.
That's right, Mai. And previously in Teen Talks, we had our nickel-free friends Tanusia and Dr. Tiagar from Malaysia who discussed the effects of nicotine on the teen brain.
And for this episode, we are going to another topic, but I'm sure our friends will be so interested to hear that nicotine and tobacco not just affect smokers themselves, but also those around them.
That's right. It's really alarming to realize that the effects of nicotine extend to those who don't even use tobacco. So, with that, we have two of our doctor friends with us to enlighten us and give us more insight about the real deal on secondhand and thirdhand smoke and aerosol.
So let us welcome our friendly doctors. First is Dr. Thuy Thao, a pediatric respiratory medicine specialist and a clinical instructor at the University of Medicine and Pharmacy at Ho Chi Minh City, Vietnam. Hi, Dr. Nguyen.
Thank you, Mai. Hello to our podcast listeners.
We also have our friend doctor from the Philippines, Dr. Cory Avanceña, a pediatric pulmonologist and head of the task force on inhaled environmental hazards of the Philippine Academy of Pediatric Pulmonologists and a member of the Philippine Pediatric Society Tobacco Control Advocacy Group. Hello po, Dr. Cory.
Hello, Coco. Thank you. Hello, Mai. Hello, Dr. Nguyen. We're excited to have this podcast with you.
We're also excited as well, doctors. So, everyone, once again, welcome to episode 3 of Teen Talks, Breaking Free from Tobacco and Nicotine Grip.
Alright, Doc, so let's dive right in. So, teens like Mai and I are curious. Is there really a difference between breathing in secondhand cigarette smoke and vape clouds? They both can't be good for you, right?
You're absolutely right, Coco. Whether it's cigarette smoke or vape aerosol or clouds, inhaling anything other than clean air is not good. So both cigarette smoke and vape aerosols contain chemicals that's not good for your health. So these chemicals, they may differ between the two, but the long story short, it's not good for your health. So like in e-cigarettes, they have flavors like strawberry, chocolate, butter, and they're regarded as safe to eat, but definitely not to be inhaled.
In addition to that, no matter what form, either cigarette smoke or vape clouds, when they are inhaled and exhaled, they give the same negative impact to those who will be exposed.
Also, we are quite familiar with secondhand smoke, but it is the first time I know that there's a third-hand smoke. So, can you tell us further how the two differ from each other?
Yes, when a person smokes, he inhales a significant amount of harmful chemicals from the cigarette, known as first-hand smoke. And mind you, it's 7,000 chemicals per puff. When it inhales, it is then inhaled by people around them. That is secondhand smoke. This smoke can travel up to 7 to 9 meters and contains toxic particles that may settle on objects like children's toys, stuffed animals, curtains, carpets, and clothes. Now, if anyone comes into direct contact with those objects, the toxin can enter the body. That is total smoke.
So imagine 7,000 chemicals per puff, and it's not even per stick of cigarette. So a smoker will inhale the 7,000 chemicals, then will exhale these same 7,000 chemicals to be inhaled by the second-hand smokers. Then the rest will settle elsewhere to be inhaled by the third hand smokers. So imagine if a smoker carries his baby, then the baby will inhale the chemicals or it may just be absorbed by their skin. So that is why it's really important for non smokers, especially children and pregnant, to avoid exposure.
Yeah, so it's really harmful for pregnant, right? So like what happens if someone pregnant is exposed to cigarette smoke or vape aerosol?
Moms exposed to cigarette smoke or vape aerosol during pregnancy are more likely to have babies with lower birth weight or worse, may have stillbirth, meaning babies who are born lifeless. Children whose parents smoke also have higher risk of illnesses as adults, cancer, heart and lung problems, meningitis or brain infection, ear infections, fire-related injuries, and babies exposed under 1 year have higher chances of being hospitalized compared to babies with no exposure. Smoke damages lung lining, make it more difficult to fight infections.
And you have to bear in mind that once you start, it's hard to quit. And that's because of the addicting quality of nicotine. So, this was discussed in the previous podcast. So, children of smokers are more likely to smoke themselves, usually during teens. So, Coco, Mai, it's a never ending cycle. So, children with parents who smoke or vape are practically exposed their whole lives. We have to break that cycle.
Wow, it's crazy to think how it affects our health. And yet, can you believe how many people still smoke these days, Mai?
Exactly, Coco. And it was mentioned during the previous episodes. No age, no gender. Harmful effects of smoking affect everyone. So, how long will this effect manifest?
Effects can be immediate. Like if you're an asthmatic, you can immediately have an asthma attack, like a wheezing, coughing fits, difficulty in breathing, the moment you're exposed to the cigarette smoke or the vape. And research shows that harmful respiratory effects from secondhand smoke exposure can occur within an hour and can last for several hours after being around it. Then the long-term secondhand smoke or vape exposure can raise the risk for serious health issues like heart and lung diseases, as mentioned earlier by Dr. Nguyen.
And compared to non-smokers, smokers have a 20 to 30 times higher risk of developing lung cancer, and non-smokers exposed to secondhand smoke have a 20 to 30% higher risk of lung cancer. So basically, those exposed have as much chance of getting lung cancer as the smokers themselves. This risk depends on the duration of exposure. Therefore, if children are exposed to cigarette smoke at an early age, meaning prolonged exposure, their health effects will be more severe.
So, even third hand smoke can cause serious disease, especially for children and us, Coco, as teens. To be honest, like when I was a kid, I lived with my grandparents, and my grandfather used to smoke a lot. Like he smoked almost every day, and at that time I was still young and didn't know much about smoking. But the strong smell of cigarette smoke always made me feel uncomfortable. Even till now, I am haunted by that cigarette smoke odor.
I can relate to you, Mai. When I was in elementary and we were introduced to the respiratory system and my teacher showed us a picture of a smoker's lung, I was very, very afraid. That's why I've been wondering about smoking and vaping. So what would you say, doctors, is a safe distance to be from someone who is smoking or vaping?
It depends really on a few factors like the wind speed and the direction. So if there's a breeze, maybe 6 feet should be enough, or even less if the wind is blowing the smoke away from you. But for the safest distance, I'd say about 20 feet away from the source of the smoke or the vapor. But really, the best thing is to be in a smoke free environment if you can.
Yeah, so like smoke-free environment, like how long do particles of the smoke stay in the air of a room before it is safe and regarded as like clean air again?
With 2 months or even longer might depends on the ventilation of the room. And as mentioned, the concept of third-hand smoking or vaping, which means it can stick to anything in that room. It is the legacy of smoke of an aerosol.
So is that if that's the case, is there a way to remove them?
You know what? These particles can be so small that you don't even realize that they're there. So, baking soda, charcoal, vinegar may help, but based on studies, nothing really can help remove these chemicals. So, the best is really to avoid smoking in enclosed places.
Yeah, and that is what we are aiming for this podcast is to reach as many teens. So to become a generation living in a smoke-free environment with our nicotine-free teen friends. So given the real deal and the effects from the first to the third hand smoke, what can we do to minimize and prevent the harms of cigarette smoke in general and cases of secondhand smoke and third hand smoke in particular?
Currently, in Vietnam and worldwide, efforts to control the production and the use of tobacco face many challenges. Although we have laws to prevent the harm of cigarettes, with administrative fines for smokers in public places like schools, hospitals, offices, and parks. People can still smoke in restaurants and religious establishments. Conventional and electronic cigarettes are still being sold. Therefore, at a macro level, it is crucial to improve the policies of higher authorities. At the family level, parents should set an example to their children, educate them about the harm of cigarettes and vapes, supervise to prevent them from smoking or vaping, and not allow them to go to places where smoking or vaping is permitted. Schools should have extracurricular activities like clubs that teach about the harm of conventional and electronic cigarettes. Teachers should be the role models for students by not smoking or vaping, and they should be trained in assisting families in monitoring students who smoke in the secret. Healthcare professionals should pay more attention to smoking issues in their patients and educate parents, both adults and children, as well as their families and communities about the harm of cigarettes, be it first-hand, second-hand, and even third-hand smoke.
No, you're absolutely right, Dr. Nguyen. Collective action is really necessary, and it's so heartwarming to know that teens like you, Coco and Mai, you're getting involved in these environmental issues. So I would like to share with everyone a saying that the Philippine Academy of Pediatric Pulmonologists is advocating. And we don't really know who coined it, so credit to the owner. So it's not one puff ever. NOPE. Nope. So the idea is that you never even try it so you don't get addicted. So that way, hopefully, future generations won't pick up the vice of smoking or vaping. So it's really about breaking the cycle.
That's very witty, doctor. Not one puff ever. I like that. NOPE. Nope. It's catchy and easy to remember. And for those who have started, it's not too late. We can always say, not one puff ever again.
Yeah, like countries are like concerning about this problem, and that's actually a good one, Dr. Cory. The real deal here is NOPE. We are not going to puff smoke ever. And Coco, for those who have already tired, it's not too late. Not one puff ever again. And to our nickel-free teen friends, nope.
Thank you very much, Dr. Nguyen and Dr. Cory. It was really a fun and interesting time learning with all of you.
And I'm sure, Coco, that our friends also learned a lot from this episode. And if you guys missed this episode or other episodes, you can always go back by subscribing to APLCN podcast, Teen Talks Breaking Free from Tobacco and Nicotine Grip.
You may also listen to this podcast through Spotify, YouTube, and Apple Podcast at Nico Free Teen.
Catch our next episode with our nicotine friends Jonathan, Adesta, and Karl. We'll talk about e-cigarettes.
Until the next episode of Teen Talks, Breaking Free from Tobacco and Nicotine Grip. See you next time.